Hello and welcome to our chat today with Dr. Naomi Sutton, who this is slightly different. I was going to say this is slightly different. It is slightly different because it's in many ways we talk about sex, or people mention sex all the time, but we never really talk about it properly, and I think in a meaningful way. And quite often it's just pushed aside with a giggle or whatever it is, without understanding how important the subject is. And so we've had numerous requests about intimacy and sex, and can we talk about it more? So I'm really pleased to be chatting with you, Naomi, today.
Pleasure, absolute pleasure, Katrina. Lovely to chat to you too.
So please ask questions. So we had a number of questions put in to the box when people registered, saying, I hope that the doctor can answer the questions, but they didn't actually place the questions. So we'll need you to, as normal, in the Q&A section, just put your questions as we go along, and then at the end we'll come and we'll cover them. But Naomi, would you like to introduce yourself to our members as to who you are and what you do?
Yeah, so I'm a sexual health consultant. So I work at Rotherham for the NHS. I've also had a few media roles. So I was the TV sex doctor on the sex clinic, which no one would have watched because they're all far too sensible. But it was a good experience. And I do a bit for Steph's Packed Lunch and sort of podcasts and things like that. So I try and use my platform for education purposes. And the way we were introduced was via Becky. So I've been making sex education materials with a charity, You Before Two, which just got released. So I'm just massively passionate about education, about people having a good sex life, and also about women feeling empowered, because I think women get not the greatest deal when it comes to medicine and trials and understanding women. And so, yeah, as a woman, I'm, passionately will support other women.
Yeah, well, that's great to hear. Well, first of all, one thing is, Becky, we've just said that we would talk about where Becky is situated. She's at the top of her house because she's got builders in there. And so she's in her daughter's bedroom, which I have to say it looks magical and really, really sweet.
Yes. Yeah, no, this is not my bedroom. I'm not a pink fairy, but she's only 10. So we've just decorated her room. So yeah, I've got builders doing the cellar conversion. So I apologize if there's any noise.
No, that's fine. And my window cleaner is literally just right in front of me at the moment, if only he knew. Anyway, so I've just had a message that I've been calling you Becky. Did I call you Becky? I don't think.
Yeah, but don't worry, I'll answer to anything. It's totally fine.
What I was going to say about Becky, maybe that's why I was going to start off a sentence, was say, is the thing that you launched, I think it's important to note why we're talking about sex is because of how, as soon as sex is mentioned, there is this dark side that comes out and seems to bring out bad things with people, which is what we know, the trolling. And Naomi, if you want to just talk about what's happened to you in the last week, to give an example of why it's important we talk about sex properly.
Yeah, so I mean, I'm over 40 and my sex education at school was pretty much dreadful. It was just, don't have sex or put a condom on, you're going to get pregnant. There's nothing about STIs, nothing about pleasure, nothing about the ins and outs, literally. So very lacking. And we didn't talk about sex at home. And I've got 2 children now, and I'm passionate about talking to them about it. And I realised what they get at school is just totally inadequate about what they want to know. So just little things like, how big should a penis be? All these basic things. And if children don't get that information, then they'll go searching for it, and we know where they get it. So 50% of 11-year-olds have either come across porn or searched for it, which I think is a terrifying stat, and it scares children if they're not prepared for it. So that was part of the passion behind me and Becky's sex education material making. But anyway, they were released on Wednesday, and I've had people on Facebook leaping into my messages saying I'm a vile, sick F, I won't repeat the words, and that I'm a paedophile and I just want to abuse children and these are dreadful. And again, I think it's again, total lack of understanding about what we're trying to do, because, you can watch them. They're they're fun, they're engaging, they're simple, they're age appropriate. I mean, they've been PSHE accredited, so they will be in schools and they'll be used. But again, it is upsetting because we're doing this out of the goodness of our heart, literally, because we don't get paid for it. It's just because we know there's a need, so we want to plug that gap. But yeah, people are horrible. And again, I think if we talk about sex and how we feel sexually, I think we have to look at where we come from. So our own culture, our own religious beliefs, our own background, the language we use. So we're talking earlier, weren't we? If you're over the age of 40, if you went to school, everyone used to graffiti penises on the back of the door, but no one ever graffitied a vulva. And so already you're thinking, vulvas aren't anything to be proud of. Penises are, something to be proud of. And, fishy fanny and all those awful things that I remember people used to say. So you kind of grow up feeling, we were talking as well about fairy tales, weren't we? So, Cinderella, women are there just to then marry the prince, or, Beauty and the Beast, she was locked up in a tower or locked up in his castle and basically abducted, but then fell in love with him. So again, we're sort of fed all these strange notions. And even the way we talk about, for example, rape, in the paper, it'll be 50 women have been raped. We don't say 50 men have raped women, which I think would be much more powerful. We always talk about the victim. So I think, and I know there will be men on this call as well, but if we're talking about females, we have a very odd background of understanding our own sexuality, and we're not encouraged to masturbate, we're not encouraged to know our bodies, whereas men always, everyone laughs about masturbating and getting their penises out and everything else. So I think we're already on a back foot when it comes to communicating, understanding our bodies and being happy in the bedroom. And also, because I think one of the questions was, what is sex? I think it's really important to define that, because as a cis heterosexual female, most people would class it as penetration of the vagina by a penis. And I think we really need to redefine that narrative, because sex can be anything. It can be solo sex, so masturbation with yourself. It can be online sex, sexting, mutual masturbation, oral sex, massage, touch, kissing. It doesn't have to be defined by penetration, and it doesn't actually have to be defined by orgasm either. So the end result, I think we need to just rethink about, and not another thing we're talking about was 80% of women have admitted to faking an orgasm. So why are we faking an orgasm? And there's lots of reasons we might do. A lot of it is because we don't want to upset the partner, or we want it to end because we're bored, or we can't orgasm and we're too ashamed to say that, and we don't know how our body works. There's a lot of issues. But to orgasm, most women will need clitoral stimulation, which a lot of women don't understand and a lot of men don't understand. So I showed you my little, it's not little, it's my clitoris. So this is the tip of the clitoris, is what you see on the outside, but actually it's a big organ. And again, most people don't even know what that is. That is a clitoris. And yeah, I mean, only about a third of women will orgasm through penetration alone. So why is the end result, or why do we think about sex all to do with penetration? It's again from a very male-based perspective, in my view anyway. If we're thinking about females having sex, it should all be about oral sex. That's how the vast, or digital playing or whatever, I don't know how to say this sensitively, but playing with toys, things like that. That should be what women are thinking about more, not always putting the penis at the forefront of sex.
Yeah. And yes, I mean, and it's funny, isn't it? Sex isn't necessarily, as we know, it's not all about the physical. It's what actually is going on in one's head,
100%.
as well as to how you then receive the physical.
Yeah.
And I think that's important. And I suppose that's why it's important to have open discussions about sex, because you're saying about the trolling that you've experienced, etc. Lots of people do that because they feel threatened by it, isn't it? Yeah. So that's why they do it. And if you feel threatened and intimidated, and it's such a shame, because it doesn't need to be like that. It so shouldn't be like that. It should be something that two parties are very happy to engage in. And I think what we're going to talk about today is how, one of the things is how sex changes. You might have had the greatest sex life when you first started off with your partner, whether they be male, female, same sex or whatever. And as you get older, how it changes. That changes through age and also through, whether you have some health issues, whether they be physical health issues or, whatever those issues are. So it's important to keep that dialogue going through. So, that's what I'm very interested to explore, all of those sort of type of things. So maybe if we start off as how you see intimacy. And so intimacy means sex, I think, for a lot of people, but doesn't have to be, as you said, the definition of sex as being penetrative. How does that change, do you believe, over the ages?
Well, I think there's different types of intimacy, isn't there? There's emotional intimacy and there's intellectual intimacy and then there's sexual intimacy. And I think emotional and intellectual intimacy deepens the longer you're with someone generally, because you get to know them more, you feel safe, you trust them. But sexual intimacy, there does actually have to be an element of mystery or newness, So Karen Gurney, who writes a brilliant book called Mind the Gap, which I advise everyone to read if they're struggling with desire, describes sex in a long-term relationship. If you, a little bit like going out to the same restaurant every single night for the same appetizer, dessert, appetizer, main and dessert in exactly the same order, everybody would get bored with it. However lovely that dinner was and that restaurant was to start with, however much you totally love the food, it's going to get boring if you only ever eat it in that order in the same restaurant. So it's sometimes just as simple as changing it up, eat your dessert first, then your main, then your appetizer, or taking it to a different restaurant, having the same food but in a different room, for example, or dressing it up differently, having a salad with it or whatever. So it's sometimes about thinking, right, what do I really want out of this sexual moment, and thinking how you can change things a little bit, and that's often enough just to spice up those kind of feelings. And I think a lot of women come and see me in clinic and just go, I just can't be bothered, I'm just not aroused, I've lost all arousal. And actually it's not a medical issue, it's not a physical issue. So we should say to have sex, you need your nerves, your vessels and your muscles working together. So there's lots of medical problems that can cause sexual dysfunction. But a lot of the time, the problem with desire and arousal is because you're not letting your body get aroused. So if we try and describe a little bit about how desire works, is that, and I know I'm totally dumbing it down, but I sometimes think of it a little bit like men are a bit more like a microwave. So they'll see a sexy lady in some lingerie and be like, ping, I'm ready to go. Whereas women need a little bit more. We need to be flirty, stroke the bottom as you're leaving the house, give a little kiss, say, you look beautiful today, sow those seeds in the head, touch hands, or I've made you a cup of tea. All those little things actually make us more receptive to then becoming sexual. So, it may just be as simple as having a cuddle on the sofa, but and having a kiss and letting your body lean into that kiss. So seeing if then the arousal happens. So most, especially women, and this happens with men as well, but most women will be on what we call a sexual neutrality. So they're not instantly turned on. They're just kind of on a baseline. So you have to sort of warm us up. I say us, we need kind of a little bit more than just look at my big hard penis. I mean, you just be like, oh, what am I going to do with that? Do you know what I mean? Whereas for a man, and again, I'm totally generalizing, and I'm talking about cis men and cis women, but basically anyone with a penis may look at whoever they fancy and get an instant arousal, because it just works slightly differently in the different genders. And again, that's generalizing, and lots of people will have different opinions and different ways that they get aroused. But again, because it's a webinar, we have to talk generally. but yeah, sorry, I forgot the question. What was
No, I was just saying how it changes as we sort of get older. And it's interesting, isn't it? Because, there's clearly a difference from what you're saying as to arousal for men and for women. And then also every individual person is slightly different. And I suppose one of the important things is to show, if you show you're getting aroused, that is arousing to the other person as well.
Yeah, and I think just letting your partner know that you desire them, to saying, I really miss our cuddles. But we were talking earlier, weren't we? If you have, I mean, we'll get on to medical problems, but if you do have a medical problem and you cannot face penetrative sex, for example, it's about putting those boundaries in place, but not stopping all intimacy or all sex. So it's about saying, I don't know, post radiotherapy or something to the vulva, or, you might not ever feel like that's ever going to, penetrative sex is never going to be able to happen again, but it doesn't mean then that you can't enjoy other things. So some women can orgasm from nipple stimulation alone, so it's about looking at other erogenous zones, but being very clear so that it doesn't put you off all touch and pleasure and intimacy. Does that make sense? So
going back to the age thing, I mean, definitely something happens for women because our bodies physically change as we get older and go into the menopause. But are you saying, before we get into menopause, if you're not so aroused as you were, that actually isn't anything to do with age? It's more about maybe because you are bored but don't recognize it, or you
so desire is that, and arousal is the physical arousal. So, yes, it may be, so through different stages of your life, lubrication, for example, in a woman, or, your erection may be not as good. So there's all different things as we get older. As I say, we need nerves, vessels and muscles to be working well. If you've got things like high blood pressure, or you're on medication for antipsychotics or antidepressants, or your hypothyroid, there's lots of things that can interfere with all this functioning. So sometimes you might need a little bit of help with the arousal process. So if you've got an erectile dysfunction problem, or if you don't feel that you're as wet as you need to be, there's lubrication, there's medication. So I think it's about thinking, well, what's stopping us? But again, it's looking at that relationship dynamic. So rather than looking at just your body works, so sex should work, it's looking at, let's try and get the body to it, but also the brain, everything that's going on needs to all be engaging. And more often than not, I think it's the psychological impact of long-term relationship, boredom, blah, 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 and body issues. As we get older, you may feel better in yourself because you're less bothered than when you were when you were 18, or it may be that you're putting on weight and you don't feel as sexy. And if you do have, I know we're going to touch on menopause, but if you've got genital urinary syndrome with the menopause, you've got urinary problems, etc., you might have a bit of bladder leakage. It might be the last thing you're wanting to do is leap into bed. But again, it's about, if you can be open about those things, if you can get help with those problems and find medical help with those problems, brilliant. But if you can't, again, it's just about revisiting boundaries and having a good enough sex model. So looking at, well, I don't want you to, go down there or whatever, but I'd like you to stimulate, give me a back massage, or, play with my boobs, and you can masturbate. Do you know what I mean? It doesn't mean that you don't have to stop being sexy together.
Yeah, absolutely. So the two things that came out of that is, one is what, as we're talking about going through the ages, let's touch upon the menopause, and then, and then also at that time, that age, how, for women it's the menopause, for men it's potentially the lowering of
testosterone, but
levels.
Also, yeah.
And then if we then go on to the what we discussed briefly before, it is about the mental side of it and the therapy that's out there. So yeah, if we just talk about the menopause, would be great, I think.
Yeah. So menopause is basically lack of estrogen, so that plummets, and estrogen is found everywhere throughout our body. So I know Davina McCall's brought out all these programs, and menopause is really sexy now, and lots of people are taking it up, which I think is totally amazing. Even if you don't want to have systemic HRT, you can have topical HRT, which potentially is going to be available over the counter without a prescription soon. It's going through the processes, but again, it's incredibly safe. So if you did have urinary problems, dry vagina, burning, that kind of, lack of anything going on down there, and you just wanted to use topical, using it for a year is like taking 1 milligram of oral estrogen. So it's so low dose because systemic absorption is tiny. So it's really, really safe to use. The only contraindication would be unexplained vaginal bleeding. That's the only contraindication to using that cream. There's also vaginal moisturizers and obviously lubrication. So moisturizers are different. That if you use topical HRT, that will re-estrogenize that whole area, so that plumps back up the skin, etc. The moisturizers will maintain whatever you have left, if you know what I mean. So it will keep the moist, a bit like skin moisturizers, I suppose. It's not going to reverse the signs, but it can definitely help. And then lubrication is to use when you're having any kind of, sex. If you're having any kind of penetration, that's definitely helpful. Or even clitoral stimulation with lube can often feel much, much better. And another thing we were talking about before, weren't we, that, I think toys are really great thing to bring into the bedroom, especially as we get older. You might need more stimulation. So for men, you can get, sort of things that you put your willy into and move them up and down, feel nice, apparently. Obviously, there's vibrators for women, and you may need more stimulation than you did when you were 18, especially if you've got nerve or vessel issues. You just might need that extra bit of stimulation to be able to orgasm, if that's your goal. And you can get ones that are easy to use if you've got joint problems and things like that. So Love Honey is a really good site to go on. But even Tesco's sell clitoral stimulators now. I mean, we're living in an age of wonder. So Divine do vibrators now that can be sold in Tesco's. So yeah, I think it's just about rethinking everything if things are having a problem. And you were talking about therapy as well, weren't you? So obviously, if you have a specific medical problem, definitely go and see a doctor. What I would say about medics is we get very little teaching on sex through medical school, and unless you've developed an interest for it, you probably have never really touched on this subject. And we are all human beings. We've all got our own experiences, our own cultural background, our own religious beliefs, all these other things that will be in the room with you as a patient. So if you feel that whoever you're talking to isn't giving you what you want, see someone that you feel you can talk to openly. Please don't give up just because one doctor or one nurse didn't take you seriously. The number of people who go, oh, I've got pain when I have sex, and the GP just told me to use lube and have a glass of wine. I mean, God, and it's just, again, it's lack of knowledge and it's ignorance. It doesn't mean they're trying to be unkind. It's probably just they just don't understand that area. And it's a little bit like, if someone came to me with a broken leg, I'd be like, oh, I don't know what to do. But hopefully I'd refer on to an orthopedic surgeon rather than just go, oh, I don't know, go home.
And I think, in fairness, isn't it, quite often, if you've got a 5-minute or a 10-minute appointment, quite often it may take a while to actually get to tell the doctor what your problem is. And then the doctor's thinking, I've got 1 minute left to try to sort out something that's a minefield, for want of a better word, isn't it, of issues.
But again, I think if you manage to open that up and you get an okay response, you say, can I book in a couple of weeks and revisit this? So, don't stress the GP out by going, God, I need to talk about it now. We are all under pressure and stress. But I think if you find someone that you can talk to, none of this is urgent necessarily. It can all be discussed. And also, if you just say, I've got, I think it's more than reasonable to say, can I come back and discuss this at a later date? And the other thing we were talking about earlier, weren't we, is psychotherapy. So psychotherapy, I think, is totally underutilized. It's often private. So I think, for a sex psychotherapist, you often have to pay privately. But I think we should utilize psychotherapy before things go wrong.
So what would you define as psychotherapy?
So a psychotherapist is someone, so when I'm thinking about a sexual health, not a sexual health, a sex psychotherapist would be someone who would maybe deal with vaginismus, relationship issues, premature ejaculation, delayed ejaculation. So a lot of ejaculation problems or sexual problems stem from the head, the brain. So, for example, they've always masturbated in the same position, so they can't ejaculate within their girlfriend or whatever, or they've got vaginismus from previous sexual abuse that they need to work through alongside working with the physiotherapist, for example. So often it will be a two-pronged thing, but most sexual dysfunctions have a psychological element because of, that cycle of, so if you have a bad response, if you have a bad experience, you're then much less likely to lean into that kiss, to want to go there, because you're like, God, it was awful. Oh, and then so you avoid, then it becomes a worse circle. So it's almost like a negative feedback loop, isn't it? You're like, oh, I don't want to go there. And that's what creates all these relationship problems, is that no one is open and says, it's because it really hurt me, but I don't know what to do. What should we do about it? Can we take penetration off the table? Most people don't do that. They just avoid the whole thing. They avoid kissing, they avoid touching, because it is really difficult to talk about because of how we talked before. We're brought up quite shamed about talking about it and about being open about it, and shamed about the fact that we might want to have sex or might want to orgasm. We're all, so again, I think it's about looking at how you think about sex specifically, what your relationship dynamic is. Does your partner have problems as well? What's been going on? And I think a psychotherapist can sit there as a totally unbiased opinion. And
would you go there with your partner, or would you go there on your own, or would it?
I think you could do either. Again, I think it depends on what the issue is. So if it's a problem mainly with, say, I mean, I know I keep saying vaginismus, for example, but say you've had some sexual abuse or something, and so you've vaginismus is basically an increased tone of your pelvic floor. It can happen through lots of reasons. Sometimes there isn't a reason that we can pick up, but sexual abuse could be one factor.
And what is it exactly?
So people would maybe describe pain during sex, but it's pain at entrance. So it's at the entrance of the vagina, and it's like a burning pain. I mean, some people can't use tampons because the vaginismus is so severe. Some people can't ever have penetrations. They can't, within a marriage, that it's babyless, and there's this unspoken secret that they've never been able to have sex because he can't penetrate. It's just totally like a locked door. So right. I mean, that's very severe. But you can get, so post birth trauma, for example, you can have an element of vaginismus just because you're terrified of that pain. So, and even a bad episode of thrush can give you a little bit of increased pelvic tone, and so then it hurts because it's very tight, and so it's sort of a burning pain, and then again that can set up that cycle of pain. So your body goes, I didn't like that, and so it's almost like being, it's a reflex. You get punched in the eye, you blink, so it's a bit like that. You get, so you can have primary vaginismus, which is from whenever you've ever tried to have sex, and then secondary vaginismus would be following normal penetration, should we say. So it's happened because of
on the pain side of it. Didn't you say that it's like 40%, was it? I can't remember, that you said a stat earlier.
About 8%, some studies would say, of women have pain during sex, and actually vigorous stimulation of the cervix can cause a bit of sex and cause a bit of pain, and that's actually fairly normal. But pain during sex that's continuous is obviously because of some medical reason normally, and sometimes rarely it might be because the partner's very big, for example, and you need to think about positions, about where you're more in control or can sort out the depth. I'm trying to say this politically, but things like endometriosis, previous surgery, PID, cancers, all sorts of skin problems, lichen sclerosis, menopause, all these things can cause pain. So it's about finding out, getting a really detailed history about the pain that someone's having, and then trying to determine what it is that we can do to help.
So going back again to the psychotherapist, is there a difference between a sex psychotherapist, or is it a sexual counsellor? I don't know. Are there different types of people that you go and see?
Oh gosh, I mean, it all depends on their qualifications, I think, and forgive me because I'm not very aware of that. But most I think most people are private. There is some NHS availability. It depends where you live. So some people will have a psychosexual clinic that they can go to for erectile dysfunction. They'll have a psychotherapist working with them, but lots of places don't. So I think it's about finding out, if you do have a problem, finding out what resources are available within your area. But if not, I mean, so you could go and see a relate counsellor, for example. So that's just to do with relationships, but they wouldn't maybe go into the ins and outs of sex per se. So it really depends on what the issue is. But if you've got if there's an issue with sex and your relationship, I think a sex psychotherapist would be. So registered with Corset, CORST, is the certified organization. That's the sexual psychotherapy body. So CORST. So if you look for a CORST therapist, if you've got sex and relationship issues, that's a good place to start.
And so, I suppose what we were saying earlier is it's the sooner you can start if you feel there's a problem, the sooner you can start talking about it. If you can talk about it together is great, and go to the counselling together, great. But maybe sometimes you have to go on your own to a counsellor to help you understand how to get your partner to understand there's an issue.
Yeah,
totally.
You
need to go together.
But also you might have deep-seated attachment issues, or deep-seated issues about your own body, and the way your mother brought you up. And I mean, we've all got issues that without a doubt. It's whether or not those. So we were talking, weren't we, earlier, about, I think it's about 40, just over 40% of people will have a sexual dysfunction.
That's where only about came from. I think it was 40 somewhere.
But only about 12% will be distressed with it. So again, so it's about, have we got a bit of a sexual dysfunction going on, or every now and then the penis goes down a bit and we don't complete sex. If that's fine and it's not causing distress, that's great. That's where we want to be, if that's okay. But if it's causing distress between you or the partner, that's when I think you need to look at it, because ignoring it is just going to make it worse. And so I know we've talked a lot about women, but men and their penises, they're brought up that the penis is virility, it's a man, it's how you are as a man. So losing that erection can be hugely devastating. One thing I would say as well about desire, I know we talked about testosterone in men, testosterone in women, although it's not licensed, it can be helpful for libido. But again, that's it's kind of small print, and that would be for an expert to kind of look at, really.
So I think the takeaway is, as soon as you think there's a concern or an issue, whether for you, maybe you don't have a problem, but you feel your partner does, to start talking. And then the psychotherapist or whatever therapist you will go to, I suppose one of the things is the fact is that they probably heard it all before in different guises, and not to be embarrassed or concerned, and that they will help you discuss it. And to get, I think you said that they give you practical sessions. Presumably you don't carry them out in front of them, you do it as your homework, or see these films where they say you do things.
So that they'll give you ideas, or so obviously depending on what the problem is, they'll say, well, look, why don't you try this and we'll review this next week, or whatever. And I think because if you go as a couple, you're both there, you're both on the same page, it takes that embarrassment out of the way. I think it's the embarrassment about opening up these conversations. If you've got someone who you can do that with, that takes all the pressure off. Saying earlier, weren't we, what you don't want is to cause a massive argument, and because that will then make it worse, because then it's something you can't go back and visit. So it can be a really delicate conversation to open, and it's just dependent on how the couple relates to each other. Some will use humor, others will do it driving along in a car, so they don't have to look at each other. often I talk to my teenager. It's always a good trick. But so again, it depends how you feel more comfortable. Go for a long walk and just say, I was thinking about blah, or say I was listening to this webinar and they were talking about this. What do you think about it? Or, find mind the gap, read that, give it to your partner. Do you know what I mean? So sometimes it's just having a prop to start that conversation.
Interesting enough, we did some work with some ladies around vaginal atrophy, which is obviously, I suppose, to make it easier to understand. It's just as you with menopause, when things start getting drier, it's not so lubricated. Can't think what the word is
lubricated.
Now. That's the word. The word. And I was thinking, how are we going to get people to come forward so we can support and do some research? And a lot of those ladies that came forward, and they were so generous with their information, was saying that they loved the opportunity to do this because they could then go and talk to people about what they've just done with Talk Health. And as you said, it was a prop to start the conversation off with.
Yeah. And that's how most things happen, don't they? So I'll have seen a case or something that I go, oh, and you'll want to go and discuss it with, that's how human beings interact. So I think it's useful if you can think of an angle rather than just bringing it up, because, and also get the right time, not whilst you're just about to go and pick the kids up or, cook the dinner or whatever. Make sure you've got time planned away from distractions, because sex is difficult to talk about. Even doctors I see in my clinic every single day to train, they're like it's awful. You can feel the anxiety vibes coming off them. So I would say as well, I just want to share, because I think everyone looks at me as this confident, I can talk about sex, great. I've not always been like this. It's taken a lot of practice. And when I became, so even doing the sex clinic, I remember going, God, everyone's so blooming open, and because I was quite, medical. Chlamydia is an intracellular organism, and I never used to talk about masturbation in my clinics or vibrators or anything like that. And then after the sex clinic, I became an Eva Peel ambassador, and I went down to this photo shoot, and everyone was shouting about, we need to use the word vulva and vagina, and I was like, oh, these women are mad. And I realized I was totally shamed about my own body and my own vulva. And I had a daughter who was, well, still God's daughter, hence being in her bedroom. But at the time, I remember going to, way before this, I remember going to, coffee mornings and saying to other mums, what do you call your girls' bits? And they were like, oh, I don't know, Fanny. So I was calling Molly's bits front bottom. And I was like, why am I doing that? Why am I passing on this shame that I feel about a vulva? So anyway, so after this Eva Peel thing, I realized, oh my God, I really need to get with the program here and follow through with what I'm preaching. So I went home, we had a dinner table conversation, I said, right, from now on, the vulva is going to be called the vulva. And obviously the vulva is everything you see on the outside, the vagina is the tube inside, because most people call the whole thing the vagina, which is totally wrong. So anyway, obviously in the shower, I'll just say, Molly, wash your bits. But she knows what a vulva is, what a vagina is, as does my son. But that taught me that we've all got inbuilt shame that we need to unpack, issues that we have with certain words. Because I know you said earlier, moist. And everyone goes, oh, a horrid word. Why is it a horrible word?
Because it's something I listened to is like one of the worst words to use, that people name it as one of the worst words ever.
But why?
I've no idea.
But isn't that ridiculous? And I think it's, again, related to a female vagina. I might be wrong, but again, I just think we need to think about why we're cringed about certain things. Is it right to be cringy, or is it because of some previous experience or previous teachings, or and actually think, do I want this to change? Do I want my daughter and sons, or cousins, whatever, to grow up thinking like I do? Well, I don't. I want them to be proud of their bodies. I want them to have really good sex lives. I want them to be able to communicate with their partners and say, do you like to be touched like this? Does this feel nice for you? That's another really good thing to do, is rather than just being silent in the bedroom, saying, oh, I really like it when you touch my bum or whatever, or, I really liked it when you did that. Often it's good to start with a positive. I really liked it when, rather than, the negatives. Don't go, I didn't like it when you did that. That's never a good starting point. But again, so that just, what I want to let everyone know is everybody can be better than what they are with regards to talking about sex.
Definitely. So I'm just having a look at the time now. So we've talked about how intimacy changes in relationships, through age and just general time with the same partner, communicating with your partner how important it is, and to be very careful, as we spoke about, is that if you're going to start opening up, people are so sensitive about it that you're quite often on the back foot to start with, and you say one thing wrong and it could then take you further back. So be very careful when you start that communications with your partner, that, God, because you always think, oh, maybe it's my fault, isn't it? You're very defensive. How to improve intimacy? I know that we've really spoken about we've talked about physical things of how to improve it. And I suppose relationships are the things of, a fundamental way to improve it.
Yeah, and again, I think how we sort of touched on, let your partner know that you're desired. Everybody and everyone wants to be seen and heard. So actually, think about it. Are you coming home, rushing around doing the washing up and all the rest of it, blah, 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 blah? Do you actually sit down and say, how are you, darling? You look beautiful today. Would you like a foot rub? I don't know, or whatever, or should we go and walk the dog together, or something that you can do together that maybe you haven't done in a long time. And I think just sit and actually listen, turn all phones off, turn the telly off, turn the radio off, make time for each other, because I think all human beings want to connect, and they want to feel heard, feel understood, feel seen. And I think that then will lead to better sexual intimacy. Because then, then it'll be like, oh, well, because, once upon a time you used to fancy each other, we presume. So, it's about showing them that you're still there, you still love them. And it's just difficult. Life is busy, isn't it? It's really busy. And it's taking that time to think, what do they need as well? And say, what do you need from me today? How can I, make your day better? And I think if you start with that kind of intimacy, it will then lead to, and remember just to not put blockers up, lean into that, when they do go, oh, thanks, give you a hug, maybe linger in the hug, nibble their neck. I don't know, whatever, rather than just it being like a best friend.
Yeah. And, we talked about medical conditions, and you reeled off a whole list of loads of different ones, and and I was just thinking, so one of the main things is that you were saying that with sex you actually have to have some physical things working to be able to feel it, and I suppose that's why it's important to go to the doctor to make sure that it's not just a physical problem that may be stopping the issues.
And sometimes we can't do a lot about what's going on. So sometimes it's about thinking about what's good enough for you. So if, say you've had a hip replacement, or, you've got dreadful arthritis, you might not be able to do that position that you both love. But is there something else you can replace it with? Or, for example, you find it much more difficult to orgasm. Well, can you bring a toy into the bedroom, which will then produce the same effect? Or, you've got sore, I don't know, or penetrative sex isn't on the cards. Well, can you masturbate together? I think it's just about thinking, well, what can't we do? And try and get help. But medicine isn't 100%, and we do all get older, and things do stop working, sadly. And I think being healthy, not smoking, healthy weight, all these things can have a really good effect on your maintaining your sex life.
What do you think Anne Summers has done to the market? Do you think that what's her name, Jacqueline? Is it Jacqueline Gold? Isn't it?
Who is that? Who set up Anne Summers?
Yeah.
I think she was amazing. She was really early on, wasn't she? In the, the Ann Summers part and stuff. I mean, I went one. That was when I first got my first vibrator at the age of about 23, I think. I mean, for me, I think it's incredibly empowering for women to understand their own bodies and know how they work. And so, I'm a massive fan of toys and, self-exploration, and just solo love. So, we should say as well, we're presuming everyone's got a partner. So even if you haven't got a partner, it doesn't mean you don't have to be sexual. So you can be sexual with yourself, get some erotica on the, audio erotica, or watch some porn that you like. So Erica Lust does, female friendly porn, and there's lots of female friendly porn, and have a fantasy, and, use some toys, or, whatever you feel like using. But you don't, just because you don't have a partner, it doesn't mean you have to stop being sexual. And I think that's really important as well. So a lot of the time in clinic, we'll say, when did you last have sex? 4 years ago. What we should follow up with, are you happy with that? Does that suit you? And we don't. So as doctors, we go, great, okay, no risk of STIs. What we're doing, it's one of those golden opportunities to open that conversation up and go, and does that suit? Are you with a partner? Are you both happy with that situation? Is there a problem? But again, most of us either don't have the time, or we don't know where to go with it. And again, I think with a lot of sexual dysfunction, it's poorly taught, but also there's a lack of evidence and a lack of knowing what to do. But I still feel by having a chat about what's normal, and that, lack of desire can be totally normal, all these things, it can just help people feel like they're not alone. And I think that's really important.
And how do you know what is normal when generally people don't talk about their sex lives, or they make it up, or whatever?
It's a bit like Facebook. You see all these happy families. Everyone's always happy, smiling. Look at my beautiful children. You don't put on the, when they're screaming and they've spilt, tea everywhere, or you hate them. Nobody does that. And very like the movies, it's always, everyone looks glamorous. No one falls out of bed and has cramp, or, can't get it up, or all these, it's totally glossy and ridiculous. So I think it's about understanding. And I should say as well, it shouldn't be about quantity of sex. It should be about quality.
Yeah.
So, you could have sex once every 6 months. If that's enough for both of you, and you really enjoy it, and that's enough, that's fine. As long as you're both on the same page. Or you might want to have it, every day. But no one has the time for that. Unless when you're a student, fine. But so again, think like frequency changes, that doesn't mean it's wrong. Or as long as you're getting some kind of pleasure or enjoyment out of what you're doing, I think that's important.
Right, so just going to ask some questions. I just noticed in the chat people have posted, so somebody, Jacqueline, has said, so straightforward and enlightening, really enjoying this and making me smile. And I think that's what it's about, isn't it? It's like, it doesn't have to be really heavyweight and serious, because sex really quite often should be fun.
Well, I mean, I always think when you think about human nature, we look for food, shelter, and then pretty much sex comes very high up on that agenda, because that's it's pleasure that drives us. It's not procreation, which again is why I think sex education is wrong in schools, because we should be thinking about, well, why does my 13-year-old have an erection? It's not because he wants to get someone pregnant. It's because he's looking at girls going, oh my, there's hormones going on. He's all about, he's like a raging ball of lust. And as our 13-year-old girls, well, we'll say 16 for but some people develop earlier. But so it's so when you're then saying sex is about having a baby, blah blah blah, it doesn't make sense to them. So it's totally unrelatable. So again, if anyone does have children, I'd definitely start, open up those conversations. A really good site to get help for talking to children is called Outspoken Sex Ed. So it's a social enterprise, and they have a newsletter that they do. I think it's every month or 3 months. and it rises in your inbox, and it just kind of reminds you of what's going on. So, for example, the stat about porn and children watching it, I was like, bloody hell. And it's just those little reminders, and they'll talk about, there'll be the latest podcast, whatever. Anyway, they're great. And they've got really good resources on how to open up those conversations about consent and things like that. Because I really think it needs to come from home as well as schools. But, home is where, as parents, you have much greater influence on how your children think about sex than anybody else will.
Yes. And especially if you're brought up with it, it doesn't have to be thrown in your face, but it's just there. Yes. It's part of life. It's normal. Yeah. And one thing that we haven't really said, and I think it's really important to stress, is that if you don't want to have sex or what, that's fine as well.
Yeah.
It's huge pressure, isn't it? That you've got to do it. How many times it averages every week? I mean, it's rubbish, isn't it?
Total rubbish. And actually, when interesting, whenever I say, when did you last have sex? People go, oh God, 6 weeks ago, like it's a shame thing. And then they go, but my husband's been ill, or we've been really busy. And I'm like, you don't need to explain. So we are all obsessed with putting up a front than, I had sex yesterday. It's stupid.
It's not an exam. It's not you get prizes when you.
No, I know.
I mean, what is the average? They say, is it 2 point? Well, I know it used to be 2.5 kids, but was it two times a week or 3 times a week used to be the average?
But I
don't know who's average.
I think that depends on age as well, and yes, I do see some people who are still having sex every few days, but most people, it's a few weeks ago, and I think that's okay. If that's okay between you and them, and your relationship otherwise is happy and functioning, and you're communicating, and all those things about being seen, I think that's lovely, and I think that's all we can hope for. And we did talk, didn't we, earlier about slightly alternative view, but that actually monogamy is a totally made up concept, that human beings would probably naturally be together for 7 to 10 years, and then we'd look for another partner. And that's why relationships break down and people have affairs, is because we get bored. And that shouldn't be a shame thing. That we just need to kind of go, well, actually that's normal. And I'm not saying everyone needs to run out and go and have an affair. That be, you've got to decide how you feel in your own relationship, but acknowledging that people will look at other people and go, yeah, they're sexy, is a normal part of life. And I think, that's an important thing to keep in the back. We are animals. So, and I don't mean to say that, and because obviously people will have been hurt from people being unfaithful and, disloyal. And that's a real punch in the gut if that's happened to anyone. I don't mean to insult anyone like that. But from my point of view, when I'm sitting there and I see the shame and the guilt that it causes, but I kind of understand from a sexuality point of view why this is happening. So, I'm not condoning it or saying it's right or wrong, but it is a fact of life. And I think it's something just to, some psychotherapists spend a lot of time with couples opening up relationships. So both the men and the women maybe want to have sex with different people, or one does or one doesn't, or, and that may be the answer for lots of couples. And again, I find it interesting when you're young, you're like 18, 19, whatever, you go out with your boyfriend and, you're together for 2 years. Oh, we split up. Oh, well, never mind. More fish in the sea. To end a marriage, it's really shame. It's associated with a lot of shame. It's like, oh, a failed marriage, a failure. Well, I think we need to kind of rethink that and think, well, maybe you get married for 10 years and then you reassess. You either retake your vows or you go different way. I don't know. I'm just throwing it out there. We're all animals.
Just one last question. How do you get back to intimacy after giving birth? I'm sure you get asked that. It's a big thing.
It is massively big, and I'm not sure I was particularly good at that. Again, I think if it's from a woman, I think the mother needs support. You need sleep. You need some time alone. So, you need to be able to enjoy your own thing and be a woman that you feel is going, so part of the whole psychological being is you don't just want to be a breastfeeding cow lying in bed and cooking and feeding everyone. You need to be able to, daddy or whoever needs to say, right, I'll take baby away. You go to the gym, or, go and have a nice walk, or go and have a bath. And, I'm going to cook you dinner. I'm going to look after you. That is what you need to, I think, to then get back to intimacy. Because if you're just being pulled from pillar to post, which I think happens with a lot of women, is you just, put upon by every single person in the world, and no one actually thinks about your well-being, you're not going to want to then, get in the bedroom and put on your sexy lingerie because you're knackered. So it's basically, I think about, and also you may have issues with, post-birth trauma, is everything okay down there? I guarantee the vast majority of things will be totally normal, but I do see women who go, is it okay, and I'm like, yeah, it's totally normal. So sometimes it's just a reassurance of going in and saying, if you've had episiotomy or whatever, is this healed? And it will be, but it's sometimes about having someone who looks at vulvas and vaginas all day to say it's totally normal.
Because how do you know? You don't know, especially if it's your first child. You go, well, I've got no idea. Is that normal? Is that right? So,
and it will be very, very different post. Like the vulva, if you've had a vaginal delivery, your vulva will look different, and vulvas age as well. A really good site to look at. Well, it's mainly about labia, but I get asked a lot about, are my labia normal? So the labia are the lips. So lots of women worry about them being too big, or mainly too big, because often in porn they've been removed. But labia libraries is a really good site for anyone who's worried about labia. So I'm trying to think if there's a vulval equivalent. There's a cervix equivalent. My Beautiful Cervix is lovely if you want to look at lots of cervixes. Then maybe there is a vulval one. But again, I think it's, there's nothing wrong with getting a mirror and having a look. And that's really healthy, because vulval, it's even Get Lippy Week, isn't it? So vulval cancers and vaginal cancers, they're a thing. So, knowing your own body and, picking up changes early is a really good, positive thing to do.
Totally, yeah.
It's funny, I'll have fitted a coil in someone, and I'll say, you need to put 2 things into your vagina and feel for your threads. And they look at me like I've gone mental, and they go, what? And I go, feel for your cervix. They're like, oh, no, I couldn't do that. Yet they let someone put a penis in there, but they can't put fingers into their own body, which actually is deeply rooted somewhere, dreadful. And that makes me really sad, because that's stopping that woman then ever being fully at one with her own body. If she finds something gross and disgusting about her own body, so gross that she can't put 2 fingers into your vagina, that's that needs sort of psychotherapy probably. That's like there's some trauma going on, or some constant dreadful messaging that's made her feel that way, and that makes me sad. That really that upsets me.
But it could be that people haven't come across that before, never been told that actually that's fine to do. You should explore your body. You should be exploring it for not, for pleasure, but also for health reasons, to check. Nobody thinks twice now about touching your boobs. That's absolutely what's encouraged, and nobody's embarrassed about that. Now that's openly on television, and that you should be checking. So, which is great.
Yeah.
Anyway, time is up on the sex today. So thank you so much, Naomi. That was so interesting. And I know that people will be really interested, that weren't able to join us, live, will be very interested to hear what you've got to say. And it's just great to have a casual, I would say non-embarrassing, but an easy conversation about something that is very intimate and sensitive to everybody.
Well, hopefully it's helped someone.
I'm sure it has. Thank you so much.
Pleasure.
Bye, everybody. Bye.
Bye.